Well, tonight, continued concern in North Carolina as the numbers continue to stay high. Thanks for joining us. I'm Scott Wickersham.
I'm Erica Bryant. Now we want to take a look at the newest numbers just released from North Carolina showing 983 additional positive COVID-19 tests. For the first time in 5 days, the daily increase was less than 1,000 cases, although not by much. Now take a look at this chart. It shows the number of positive cases confirmed each day in North Carolina. Take a look at the yellow line. It represents the 7-day average, and you can see it's been going up since March, and then in the middle of May, the line starts to go up even more. And with more positive cases, more people are being hospitalized.
Let's go now to Channel 9's Mark Becker joining us live tonight, digging deeper into these latest numbers and what they mean. Mark?
Yes, Scott, there are a lot of numbers that you can look at to track and see how we're doing with the coronavirus and how quickly it's spreading. But one of the numbers, the bottom line numbers that experts will tell you about, is the number of hospitalizations. That is, how many people are sick enough with the virus that they need to be in the hospital. And that number has been steadily going up here in North Carolina over the last month. Exactly 1 month ago, according to the Department of Health and Human Services, there were 492 people hospitalized with COVID in North Carolina. Today, that number is 797. Now, that translates into hospital beds that are filling up. Right now, about 73% of the hospital beds in the state are in use. And more alarming, 78% of beds in intensive care units are full. In his briefing this afternoon, Governor Cooper said the numbers are definitely going in the wrong direction. But one of the numbers he was particularly concerned about was the number they're seeing from the hospitals.
We're watching these numbers closely to monitor for hospital bed as well as ICU bed capacity. Right now, our hospitals do have bed capacity, and that's good. But as Dr. Mandy Cohen will tell you, that can change really quickly.
One of the other things we heard, maybe for the first time from the governor today, was he is seriously thinking about requiring people to wear face masks when they're out in public. That perhaps the first time we've heard from him on that matter. And one of the reasons is that, frankly, people haven't been doing a good enough job, they believe, in policing themselves. We saw a good example of that over the weekend here in Charlotte in South End. Pictures from outside a popular restaurant there, and we'll have more on that and what that owner had to tell us coming up on Eyewitness News at 6 o'clock. Erica?
So the possibility moving forward that masks might be required, and images like that might make more people wear those masks when they go out. Thank you, Mark. In the meantime, state leaders were originally hoping that we could move into phase 3 coming up at the end of next week. But today, Governor Roy Cooper said they are still evaluating whether that can happen given the concerning trends they're seeing. He said they plan to evaluate how this week goes and then make an announcement at the beginning of next week. It is still unclear exactly what phase 3 will look like since phase 2 was tweaked and in the end did not include bars and gyms as originally thought.